Our residential mental health program is right here on site at Hanley Center at Origins in West Palm Beach. We saw a need in the patients walking through our door, and it really touched us and became the impetus for this mental health unit. We realized that people were presenting more and more with severe mental health disorders as well as substance use disorders. And what we would find is that because our programming was primarily focused on substance use, that we had to find other facilities and transfer these patients out. And then we asked ourselves, why not us? Why not us be able to provide really high quality care to people that have different types of needs?
One key factor of mental illness is the feeling of isolation and being alone, not being able to connect. And we want to make sure that our community and us, like our residential program, is providing those resources and encouraging that and saying there's a group of people that are trying to connect with you and that you can connect with, and that you'll be accepted and you'll be supported, and you can manage this with the help of these people. You're not alone.
One pattern that we noticed is that when individuals are calling, seeking out help for their loved ones, there were many people who were looking for their loved ones who might be struggling not with substance use or drugs and alcohol at all, but really needing a place for their loved one to go to stabilize in a residential facility for just mental health. And this is a real opportunity for us to have taken notice of what the need is in the community that really seems to be lacking, and to be able to create a space for individuals with just mental health struggles to come in, be surrounded by both medical and clinical expertise, and be able to stabilize here so that they can go back out into their home environment, into the community.
So the residential mental health offers an array of medical services that include a psychiatric evaluation, medication management, gene site testing. We also work with the community for patients who need additional services such as ECT and TMS.
The goal is not to institutionalize somebody or to keep them at a residential level of care, but to begin to build them up so that as they step down to less and less intense levels of care, they can be prepared for each new level and eventually prepared for living life on life's terms, but also being able to live life to the fullest.
The residential mental health program is for patients that present with primary mental health disorders, so patients that have disorders ranging from bipolar, schizophrenia, depression, anxiety, personality disorders, so a host of primary mental health struggles. We also have patients that will probably come to us with co-occurring issues with substance use, and maybe their mental health needs to be stabilized before they're able to go into a substance use program.
It's very important for all of us and for you to know that your loved one won't get lost in the milieu of this environment, as well as we have very specialized services from psychiatric and nurse practitioners to a psychologist to experientially based treatments, as well as expertise clinical services. So the amount of staff with very specific expertise there to assist your loved one is very individualized, very personal, and it's important to know that your loved one is going to be getting more of these and more attention rather than being in a setting where you can feel lost without getting the attention that you need.
One of the struggles that mental health patients often experience is finding good continuing care once they leave a residential program or stabilization program. We're really excited that we're going to be able to offer services in an outpatient setting like psychiatric services, group services, individual therapy that can help patients continue the journey that they have started with a team that they really have trusted and grown to feel safe with and really look towards for support.
When I can see somebody flash excitement in their face because they realize that they can actually do something that they never thought they could, it's powerful. It's what brings me to work every day. And I see it all the time in small things. If you're experiencing major depression, you don't even think that getting out of bed is a thing that you can do. And then you're ashamed that that's not a thing you think you can do. And then when that person 30 days later, 45 days later, 60 days later is running groups with me, is my helper through the groups, is encouraging others, is saying, yeah, man, that was my first week. I had to be told to shower every day for 2 weeks, for 3 weeks. I thought it was never going to get better. And here I am. That's more powerful than anything I can say as a clinician.
Mental health conditions, substance use disorders, these are just disorders of an organ, the brain. Just like any other medical condition, they are understood and they can be treated. And they are not the fault of the people who suffer from them. However, we continue to struggle with stigma, with people seeing substance use disorders, with people seeing mental health conditions as somehow moral failings, as somehow the fault of the person who has them. Whereas we don't think that way with heart disease or diabetes. One of the things that we hope is that we will be a place that advances knowledge so that the community can understand that mental health is health, and mental health conditions are health conditions, and that just like someone deserves to have great care of every other part of their body, they deserve to have great care of their brain and of their mental health.
You and your family members are not alone in this. Mental health has touched almost every single person in our organization, and we're so excited to be able to open this program and offer the services and the care and the compassion to help someone get well. So if you need support, or if you're just not even sure, please reach out. We're here for you.